Please read the instruction of use carefully before testing. Step 1. Tear off sealed inner package and take out the test card. Step 2. Place the test card flat on a clean platform. Step 3. Use nasal swab to collect sample. Swab should go down to nasopharynx to collect adequate sample. Tenderly rotate the swab 5 rounds. Step 4. Peel up adhesive. Insert the sampled swab from well B to well A till the tip of swab reach the top of well A. Step 5. Drip 6 drops of sample treatment solution to well A. Please keep the test card flat during operation. Rotate the shaft of swab clockwise first and counterclockwise, 2 rounds each direction. Step 6. Fold the left side over and wait 15 minutes to read the test result. Result interpretation. Positive. 2 dark purple lines appear. The test result is positive. Negative. Only 1 dark purple line appears on top. The test result is negative. Test result is invalid if 1. No top line appears. 2. The top line remains blue. Invalid test result indicates incorrect operating procedure or the test card has been deteriorated. Please test again. Step 7. Dispose medical waste. After the test, please dispose the test card to medical waste bin.